Hi, Katya.
Hi, Abby.
It's nice to see you.
It's always a good time with you in person, on Zoom, in one of
Oh,
school,
I love you for saying
in
that.
one of our events. Yeah, it's always a good time with you.
Thank you. Yes, we are kindred spirits for sure. So I've already introed you, but tell us about how you came to become the goddess that is Spirit Gate
Oh,
LA.
sweet. Um, Gosh, where to begin? This acupuncture definitely wasn't my first career. I fell into it when I personally had some really incredible experience with Chinese medicine and how helpful acupuncture turned out to be for some low back pain that I was experiencing in my early 20s. And I just was taken back by how intimate and comprehensive and holistic the medicine was. I had been seeking help from so many Western medical providers which were just focusing on my lower lumbar spine. And I had met this acupuncturist who, for the first time, started asking me questions about my stress level, my sleep patterns, my digestion, my libido, my menstruation. Like just sitting before her, talking about my whole life, I really felt like, oh, we're going to get to the bottom of this. I already felt a hope that things would feel better after seeing so many doctors and specialists that were just pumping me full of muscle relaxers and painkillers. So it was just a frustrating process. But like so many frustrating processes, sometimes you have to go through that to find the medicine at the end of the road or that like light at the end of the tunnel. And so that me up to a profession that honestly I didn't know existed. I didn't know that it would be for me. I didn't know that was even an avenue I wanted to pursue. But the better I felt in my body with the practice of acupuncture, with making herbs at home. Um, I just decided that I wanted to pull that thread a little bit and see where it led me. And it led me to a university here in LA called Yosan University, where I studied 4 years to get my master's. And after that, I did a fellowship in China where I focused on gynecology and oncology. I thought those were the two specialties that I was considering focusing in on.
You mean Chinese medicine with that focus specifically?
Yes, I knew that
Okay.
I wanted to be an acupuncturist working with women, but I wasn't sure if I wanted to go the oncology route or women's health and gynecology and fertility. Um, so I did fellowships at two hospitals in Chengdu, each of which focused on one of those disciplines, and really fell in love with gynecology and fertility and women's health from that aspect. Um, though truthfully, all aspects are the same aspect because you have to start with just the basics. You know, what is happening with somebody's nervous system? What is happening with their digestion? Where do their thoughts go the majority of the time? So kind of back to the experience I had with my acupuncturist, though I was coming in for low back pain, we were actually talking about my constitution and my patterns and my natural rhythms and what I was doing with my time and my life. So when I got back to LA is when I opened Spirit Gate, and that was in 2010. I was just using my full name at the time. So Spirit Gate wasn't officially birthed until, oh, I don't know, a few years after that.
Okay.
Um, here we are
Here we
today.
are. Why did you change it? And where did Spirit Gate come from?
I was just using the last name. It was Katya Mosely, licensed acupuncturist. It didn't have the same catchy ring to it that I think Spirit Gate has. But no, at the time, my practice was I was starting to hire associates that were working with me. And it seemed like the practice was bigger than just me. And so I wanted a name that wasn't so focused on just me, because sometimes people would and they wouldn't meet Katya Mosley.
Right.
Um, and then when thinking of a name, I remember just considering like, is there one point that I could use on everybody and feel like that would be beneficial? What would that one point be? And there's a point in auricular acupuncture. So it's on the ear, and I use it very often in practice, and it's called Shen Men. and Shen is our spirit, and Men is gate or doorway. And it really is this beautiful portal into ourselves. It's a very regulating point. It's a very balancing point. Absolutely everybody under the sun and moon could benefit from it. And so that's how Spirit Gate was born.
I love that. And actually recently learned that from you from a different panel that you were on. And I thought it was so smart, smart name. Okay, well, let's talk about when you say somebody can benefit from that point. What do you mean?
So acupuncture is really beautiful at resetting the nervous system. And there's lots of ways of doing that, but this is kind of a shortcut because it directly affects the that communicates with the brain. So by putting a needle in the ear, there are immediate effects. And in general, I think that we need to reorient our energy from planning and controlling and doing and deciding and all of these very yang traits, which are like, the energy of the sun, the quote unquote masculine energy, that happens during the daylight hours. Most of us kind of run at the same pace, morning and night, weekends, weekdays. It's just all blurred together because we're in such a fast-paced culture and there's so much emphasis on productivity and on efficiency and always multitasking, getting a million things done. A lot of that energy hinders our ability to receive and hinders our ability to trust and listen to what our body needs and trust that we'll get it. So this is especially pertinent in the fertility space and how I work with many of my patients, but it's just the opportunity to get the chi and the blood flow from being governed and lodged in our minds and getting it recirculated into our bodies. So that could be back into our hearts and our spirits, or that could be, in what in Chinese medicine we call the second heart, which is the uterus. I spend a lot of time talking about that with patients. The energy needs to be able to flow into our uterus, needs to flow through our hearts. But when we're trying to control and operate from that very like masculine place of timelines and expectations, that there can be a disconnect. And that kind of expectation, especially in the fertility space, can really amp up our cortisol levels, can really heighten our fear and our adrenaline. And that's not a very welcoming environment for conception and implantation. So that's a lot of my intention with the type of work that I practice.
I think about so many people, my clients, me when I was going through it, would hear, I don't mean to reduce it down to this, but like you're too stressed, calm down and it'll happen, right? And we're always like, fuck you, I can't calm down, I'm trying, right? Like, because we don't want to be stressed. So my question is, let's say I come to you or go to acupuncture and I can't psychologically, consciously tell myself that I'm releasing some of that stress because it's too hard for me. Will the acupuncture kind of overtake and just calm me down anyway? Or do you feel like mind over matter? And if I'm not open to receiving what the acupuncture is giving me, I won't absorb the benefits?
Definitely the former. I never want to force it. It doesn't work when we're forcing it. You might get something out of it, but it's not really authentic to what the medicine offers. And this is just a path that we can't hijack.
Yeah.
We can't hack through it for it to be, because the body will know, the spirit will know.
Mm.
Most of my patients come in describing what you just shared. And I myself had been in that place as well. So I really identify with it. I really have so much compassion for that patient who's coming in so stressed and who's sick and tired of being told to just stop stressing. Of course you're stressed. And of course she's stressed. And of course I was stressed, because when something is so important to us and so much depends on it, it's going to be on our mind. So I don't think telling someone to stop stressing is enough. I mean, it's like tell someone to calm down. It
Right.
doesn't work.
Right.
You know, it only like amps that
A
individual up.
1000%.
So, so you've been into my office. You know, I take a lot of care in just creating an environment where that's an option. So the kind of calming down that I'm suggesting might not even happen the first time that you try or the third. I mean, side note, it usually does.
Yeah.
But the expectation isn't that it has to. The expectation is like, I'm going to do my best to show up as centered and as good of a listener as I can so that you feel safe to unload all of that stress and you feel like in a world where no one is listening or understands a miscarriage after 2 weeks feels like, or what a failed IVF cycle, or what getting your period for the 8th month when you conceive, like when our environment doesn't really lend itself to that kind of like compassion for a woman going through that. um, I really tried to create a space where all of those feelings are allowed. One feeling isn't better than another, and creating a space where everyone's comfortable to share all of it. And I do that not just by being a good listener, but also the attention paid to the music that we're playing, to, you know, the heat on the massage table, to the different aromatherapy that I custom select per patient, you know. So I'm speaking to your nervous system more than to your mind. And there is a little bit softening. And that softening will hopefully just expand as our work continues. But I do believe that approaching a patient from a deep place of empathy and compassion will already begin the work of releasing some stress. And not all of it. I'm not a needle or even one session or even 50 needles in 50 sessions. But it really does come back to creating an inviting environment inside. And we can definitely make a huge impact on cortisol levels, on blood flow, on expectations, on empowering a patient to control what they can control and make peace with what they can't. And it is a process for sure. It's a stubborn process
Huh.
and it's a painful process.
Yeah, and I think people, when my clients or anyone in any of my support groups asks, should I really do acupuncture? Does it really make a difference? And I'm always like, do I know if it's going to be the thing that's going to get you to pregnancy and healthy baby? Of course, none of us knows. But at the very least, you're carving that time out for yourself with the intention of releasing some of that. So to that end, if somebody were just starting with you but had already been going through the infertility process, so past fertility process, but into treatment, into doctors, what kind of timeline is ideal for you to work with somebody who's going through IVF, for example?
So my unsatisfying to so many of these questions is it
Uh,
depends.
yeah.
What is the issue? What is the issue that's putting somebody into a doctor's office in the first place? How long have they been trying? Have they been tested? Has their partner been tested? What's the obstacle? Is it anatomical? What are we up against? So it really varies. And I try to be very realistic with everybody. But if I had to give a generalization, I would say minimum 3 months. Minimum three
For
months
egg retrieval.
for egg retrieval, yes.
Yeah.
Or for someone who's even trying to conceive, someone just got off the birth control pill and they're not
Okay.
sure if they're going to have issues or not. They're just trying to plan and they're afraid because maybe they're already a little bit older or their sister went through something or a lot of their friends went through something. So there's just a concern. I would say 3 months max. But then I also get calls from patients sometimes that are about to go into a retreat. Like, is it going to be helpful? Like, I just found out that I just read it as something, or someone just, shared a link with me, or Instagram just pushed an ad to me or something, is it still helpful for me to come in? And I always just, even with one session, there's going to be portals back to ourself that get opened up. There's going to be a connection that you're making that is hopefully going to help you even go through that next treatment with a little bit more ease or a little bit more awareness or a little of what to expect from the treatment. Um, so often in these IVF offices, we respect, and I think that they're awesome, but also, it's very hard with that number of patients to sit with each person questions patiently and thoroughly. And so what so many patients use me for is just to be a sounding board of like, so does this sound right? This is the protocol that I'm on, and here's what my friend is doing. How come I'm not doing what she's doing? Or how do I do this injection? So just having someone that is on your team. I mean, I'm sure this is what so many people use you
Yes.
for as well, because you're so good at listening to people. You're so good at hearing them out and helping to set their expectations or just help guide them with next steps. Um, that's not specific to Chinese medicine necessarily, but that is something that I get sought out to help patients with in the process.
Because you've really been through it with so many of your patients, I assume. I mean, I imagine that's why you can be so informative for somebody going through it.
Um, yeah, I can't say that I've had personal experience
Right.
with IVF or anything like that, with loss and with miscarriage and just with like things being out of my control and timelines not being what I hoped. Definitely had a lot of experience. Um, so I can offer a degree of empathy and reassurance and understanding and just a safe landing spot
Mm.
that can go a long way. Again, going back, internal environment needs to be and getting out of that like mental urge to control and think 4 steps ahead. Our ovaries really respond better to whatever the circumstances are when there's just less of a tight grip on whatever outcome we're hoping for. And my outcome is really the same. My hope is the same as the patient's. It's not that I want this to take longer and I want them to find themselves first or I want them to do something. Like I walk with the patient at their pace towards whatever the goal is. But with the needles, with just the entirety of the treatment, to connect them more with what in Chinese medicine we call the yin energy, and ability to use our intuition, to use our trust, get a place of receptivity, which so many women, at least in Los Angeles, so many women have a hard time with.
Yeah. And tell me why, like, talk to me about literally how it works, because you talked about putting 2 needles in somebody or putting 50 needles in somebody. I know that from you, like, you're very tailored to whatever that person's going through in the moment, but how does one, as a doctor of Chinese medicine, determine? And sometimes we're like, I'm here for fertility. Why are there 2 needles in my ankle? Right? Like, what? It makes no sense to us. So, can you just talk to us about literally the like science of how it works?
Yeah, that's so funny. That was exactly my reaction to my first acupuncture treatment. I was there for low back pain. I had needles in my hand.
Yeah.
I had needles, below my knee, not a single needle in my low back. I
Yeah.
was like, wait, was she listening? Like, did
Yeah.
she get it? Yeah, she definitely was listening and she got it. And, there's a whole system of channels, and some people call them meridians, some people call them channels. It's a network of um, pathways that bring energy and blood flow and oxygen to different organ systems in our body and different energetic centers. So, one approach that I take, the approach that I favor in my practice is to really flood the channel that is responsible for doing the thing that I want the body to do optimally, flooding that with energy. So I will very often use points that are at the top and the bottom of that channel to really create a flow within it. Now, of course, that's going to vary based on the condition. It's going to change based on the constitution of the patient, because if somebody is really young and energetic and has a lot of energy to spare, I can do a lot more invigorating and stimulating and moving of that channel. If someone's a little frailer, whether that's energetically or just age, or they're just really going through a lot and their all systems are kind of hindered as a result, I'm not going to, quote unquote, flood that channel with energy. I might be a lot more selective with the points that I choose. I might choose to do needles unilaterally. One of the diagnostic methods that a Chinese medicine doctor will use is to get a read of the patient's pulse. And that is just by putting 3 fingers near the wrist on both sides to understand the quality of the energy at that moment in all the different energy centers. And based on my reading of that, I will know like how aggressive of a treatment I should give, or whether I should hold back and just do a lot more nourishing and tonifying versus a lot more like stimulating and moving. So, I could have several patients come in because they're the exact same age and they all have the goal of getting pregnant, and every single one of them will leave with a different treatment. And they might also leave with a different recommendation of herbs or a different recommendation for supplements, different essential oils that I've selected for them. So truly, there are no two treatments that are the same, including on the same patient. So a patient might come in once or twice a week for several months. A lot of those treatments are going to be unique to that individual because of what their pulses are telling me about that day. And the things that influence your pulses are the quality of your sleep, hormonal, where you are hormonally. So depending on where you are in your cycle, depending on what else you're going through, your immune system, your mental emotion transmits in the strength of the pulse. And that really helps me decide how many and where I'm going to place the needles.
I love that. I feel like a lot of the research that's been done from the fertility perspective has been done more around transfer than around retrieval. And for that
Mhm.
reason, doctors often say, like, at least get acupuncture for transfer. I think you would argue they're equally important, but if somebody could only come for transfer, why is that the piece do you think that's been studied more? And what are the benefits? And I get this question all the time. What if I can only come 48 hours after transfer, 48 hours before transfer, a day after? Like, is that important?
Yeah. So I get asked that question a lot too. And it's
Yeah.
similar to the question I get asked all the time in postpartum, like how soon should be coming in postpartum? I think if I think there are definite benefits working up to any of these big milestones, whether it's a retrieval or implantation or, delivery. But if you can only come in one time, I put decision back on you to decide what do you think would be most soothing to your internal environment. If laying on a warm massage table and having someone, to speak with to get some of the jitters out, and then receiving a medicine that can only benefit the outcome, if that's going to be helpful to you, let's absolutely schedule it. But if the pressure of scheduling this appointment within 48 hours, if that is going to interfere with your ability to be present for, first and foremost, your body and what it's about to go through, because there's other things that can also be beneficial at that time, things that you can do at home, things that just like, I never promote acupuncture as the one and only thing that is beneficial during this time. And I really value a patient's presence of mind and state of mind and schedule. And sometimes getting places in Los Angeles is a real drag. And if that's going to raise your cortisol, then maybe it's not worth it for just one session. But like you said, the research has really been focused on what's called the Palace Protocol, and that is a session plantation and immediately after.
Sorry, say that
And
again, a session right before and right after.
yeah,
Okay.
so prior to many of these IVF clinics is that a patient could request to get acupuncture from their acupuncturist who is not affiliated with the fertility clinic in the treatment room room. So I would come in maybe an hour before the treatment or the transfer. Specific set of points that research has shown helps by almost 60% of the study was so it went past the first trimester. It didn't go to live birth rate, but it did go towards, to full term. And it was a very specific set of points that's done just prior to the transfer. And then the patient doesn't move. They would stay in that same treatment room. The IVF doctor would come in, do the thing, they would leave, and I would come back, or any acupuncturist had the opportunity of coming back and doing another very specific set of points. It's a very Western approach to Chinese. You just heard me say I treat every patient differently, but it's very difficult to do a clinical trial when everybody is treated differently, right? This is a study that was done trying to kind of conform Chinese medicine to a Western model where there is some uniform. And the beauty of that study is that a lot of women in the group that was exposed to acupuncture before and after had almost 60% greater pregnancy rates at 24 weeks. So that's amazing. So I do all those points. And if I have a relationship with the patient prior, then I already know their constitution and I know more of what their challenges have been. So I will also customize the treatment for their behalf. But sometimes I get called just to do something pre and post. And if I don't know that patient that well, then I just try to be really respectful to looking to get from this, which is like that specific treatment. And believe that any fertility clinics, at least here in Los Angeles, have been allowing outside acupuncturists. And I think a lot of them have done this really smart thing, which is to hire an acupuncturist on staff and have somebody there so patients don't have to look elsewhere. They can get treated right then and there, and it's all much more seamless. So for any fertility clinics that are listening to this podcast. But yeah, it is an effective treatment, and the study was done in 2, I believe, and it's still the most referenced study of Chinese medicine and integrating it with a Western model that I am aware of.
And to shift gears a little, something you touched on that I do want to revisit is your own personal loss story, because it was traumatic, of course, at the time. So why don't you tell us about it? And then I have a few follow-ups.
Sure. So, in what is called a super implanter. And before I really knew so many women face with pregnancy, I found myself pregnant and I was really excited. And I was a little superstitious, so I kept the information to myself for 12 weeks. And then at 12, I was very excited. Wasn't really expecting anything to go wrong at that point. But 16-week appointment, there wasn't a heart rate. I'm sorry, a heartbeat. And it was so shocking and just so tragic.
Yeah.
Tragic. It was such a loss. It wasn't just a loss of the baby. It was also a loss of a dream and loss of, attachment to a certain outcome and timeline and just all the things. It was just apocalyptic, to be honest, because it was my first pregnancy. So it filled me with fear of, but will I ever get pregnant? And for a long time, it wasn't understood why things happen that way. And it was through a lot more testing that they found out that the baby that I was carrying had a very rare genetic condition where every chromosome was triplicated. So instead of the 46 ours had 69. That's called a triploidy pregnancy. And it's very one chromosome that's triplicated. It's pretty uncommon to have all of them. So obviously that baby was not compatible with birth. And I started seeing an acupuncturist myself, so much of what she was doing with me was just stabilizing me again. My chi was so scattered. Was so scattered. I had lost faith in my body. I was terrified of getting pregnant again. I couldn't imagine getting pregnant again, and I was just living in the future. But what if I get pregnant again? Will I ever be able to tell anybody? How will I share with them I'm pregnant? Just living in the future because the present was just really painful. What was also really painful is that I didn't really understand that you could have depression after having a miscarriage.
Mm.
So that's something that Chinese medicine really honors. They think that a miscarriage at any point in the journey is very similar to um, what hormones go through and what a woman's body goes through is very similar to what happens postpartum. So the same care and the same patience and respect that a woman's body really needs to receive postpartum needs to happen after a miscarriage. But I wasn't as well versed in that at the time. And so I wasn't looking after myself in that way. I had expectations of just kind of into my life, and my body and spirit were not on board with that. So it was a really challenging time. And then I went on to have two chromosomally perfect babies who are now 10 and 12, loves of my life. And that was all great. Unexpectedly, I got pregnant a fourth time, and that also had a chromosomal challenge. And so we are now very um, just certain, I guess is the word that I was certain that the two amazing girls that we had are the exact ones that we're meant to do this life with.
Yeah.
And I know for a fact that I mean, of course, if that first pregnancy had worked out, I wouldn't have met the two girls that I have, and there are no other girls for me. Those are the ones, and I didn't need a third to completely, it's just, I feel really, really lucky. I feel lucky and I feel grateful that my story had a really, really happy ending,
Yeah.
but it was really dark. All four of those pregnancies happened between 8 years. And so there's, a lot of loss, a lot of emotional postpartum challenges, breastfeeding challenges, doubt, fear, and also a tremendous amount of gratitude. Um, So yeah, it took a couple years for me to be able to tell the story as like succinctly and
Yes.
factually as I'm able to do now. It definitely was not something I was even a few years ago.
Yeah.
But um, but I feel peace with how our family came together, and I feel just overwhelming gratitude.
Did you feel like you had the right support system in place when you went through that loss?
No. I didn't. I would say my acupuncturist was such a lifeline. Um, and with women is very much informed and kind of almost like just like I can't say paying it forward. I'm almost like paying it back in a forward
Right.
way. But just like I could not find the level of support professionally
Yeah.
that I did in very, very many places. And I just felt like I didn't even have to say, like when I didn't have the vocabulary to describe the anguish and the disappointment inside, because I was working with someone who had seen it a million times, gone through it to some degree herself, it just was it just was the healthiest place for me to go to heal, to feel understood, to feel like I don't even need to say anything. I get there so seen for all the pain that I'm holding and all the expectations that came like crashing down, and I always left. I mean, this never changed, obviously, but I left feeling a little bit lighter. I
Mm.
felt feeling like there was just less of a burden on my shoulders to carry me into the next conversation, the next commitment, and then that was how I like brick by brick kind of got built back up.
Mm, I love that. Okay, two last things as we wrap up. One was that you mentioned there are things people can do at home to not provide themselves acupuncture, but like what if there's one thing or a couple things or a couple points that you can play with at home to help your cortisol levels in general, what would they be?
Mhm. Well, what I meant by that when I initially said it was like figuring out what supplements you could be on that would be really, really beneficial, whether it's we're working on egg quality or we're working on um, just regulating your cycle or what we know, whatever the issue is. So I think working with a professional to figure out what supplements you should be on, maybe a Chinese medical would be really beneficial. So those are some of the things that I spent a lot of time talking with patients about
Got
really
it.
dialing in, also making sure that just like the basics are being covered. Like before you start seeing an acupuncturist, how getting really dialed in with your sleep hygiene and having really good quality rest. And that's something that you don't need an acupuncturist to do, but just focusing on. Um, I would add, how you're nourishing yourself into that list. If you're moving your body and how often. So those were some of the things that I was
Okay.
talking about. But also, I recommend to some patients that it's appropriate for, like putting castor oil packs over their ovaries, or if you have access to red light therapy, putting that over your ovaries, whether you're going for a retrieval or a transfer, like all of the things that will increase blood flow to your uterus are good things for fertility. And so, those are things that you could do on your own in terms of finding a point on your body that can help to bring chi and blood flow to your uterus and your ovaries. There is a point that I love, kidney 6, and it is along the kidney channel, which is the channel that governs our constitution. So anything related to our genetics, meaning hormones or just fertility in general, how to enhance and support that. That is a point that can be found right under the inner side of the big um called a malleolus is the bone. It's like the ankle bone, and you have it protruding on the inside and the outside. But if you find the inside aspect of it and go directly under the juicy depression and just poke around a little bit, one spot that your finger will land in inevitably will be a little bit more tender than another, and just find that spot and just breathe 3, 6, 9 seconds. Just connect with yourself. You don't have to dig into it and give it like the most pressure that you can. Chinese medicine is a gentle medicine of moderation. So just enough to find that tenderness and doing that on both sides. If you can commit to doing that morning for a couple breaths and evening for a couple breaths, and really visualize that chi and blood flow going from this ancestral energy that you carry. It's the first channel that develops in utero. So it was your first connection to your fertility and her mother and her fertility, and breathing into that vast capacity. Really, really helpful.
I love that one. Thank you. And then I always like to ask, is there a phrase or a cliche or a saying or a piece of advice that you think about on a fairly regular basis or give out on a fairly regular basis?
Oh, there's so many. There's so many. Gosh, if I had to pick just one, I would say just to stay curious. We really don't know. We really don't know how stories for any of us are going to end, whether we're talking about fertility or anything else. And fear can so often cloud our judgment into thinking that we know.
Mm,
Um, but we don't. And so I remind patients all the time, just like I remind myself, just like I remind my children, stay curious. And I think that there's something kind of effervescent about going through life that way. It
Mm.
doesn't feel as heavy as other approaches to life that I've taken.
No, stay curious is always a good one. And we always need that reminder. I certainly do, for sure. Katya, thank you so much. Anyone in LA, Katya, we will link out to her incredible practice. And going to Katya is like, it's like taking a siesta in the afternoon for your whole mind and body. It's the best.
Oh, I love that. I appreciate what you do so much. I know that women really need this. And you know that better than anybody. And I'm just
Thank
so
you.
honored to be on your podcast. I'm so honored to be sharing what I love with your community. So thank you again so much for having me.
You're the best. Thank you.